Sure. So PRP, which is platelet-rich plasma, which is taking your own blood, spinning it down, concentrating those platelets, which are your healers. We basically take that and we put them into places that can't normally heal on their own or just have not healed, the way we had liked them. So for things like your tendons, your ligaments, tennis elbow, Achilles tendon, plantar fascia, these are all places that don't have a great blood supply, and the blood really can't get there in large amounts, which is why some of these don't heal properly. So basically what we do is we put the healers in places they can't normally get to in a large amount, and we facilitate that healing. So you can heal chronic tendinopathies, like what they call tendinosis. You can also even heal some partial tears. Even if a full tear is completely non-displaced and it's close to each other, you can heal small full tears sometimes just using that. As far as things like joints go, PRP can also sometimes heal some cartilage. I've had meniscal injuries that I've seen the meniscal tears on MRI. We've done some PRP. A couple months later, the meniscus is healed, and we don't have a radiologist in our group. No one's reading it. There's no bias. We've seen them heal. So when it comes to joints, though, I usually think things like stem cells are the more robust treatment. That's where I think for things like osteoarthritis, you're going to get the better results. PRP works and people do feel good because the PRP really will get rid of that chronic inflammatory process. But the stem cells, I just think, do it a little bit better.
Right. I know that they work a little differently. Correct me if I'm wrong, but with the PRP, I don't believe PRP can grow back like bone on bone or anything like that. Isn't that pretty much just the stem cell?
So even the stem cell, if you have a bone on bone situation, you're probably not going to really grow any cartilage back, just because there's no chondrocytes for that to feed on. If you have mild arthritis, sometimes you can put a little cushion back on the tire, a little tread back on the tire. But, really the goal is to get rid of that chronic inflammation and because that chronic inflammation not only hurts, but it feeds the arthritis too. So those chronic inflammatory cells go in there like little Pac-Man and they eat up that cartilage faster, so you're reversing that process. And then you're making them feel better and they have more motion and more mobility. So, it's like I always say, you don't treat a finding, you treat how they feel, right? So you can get an MRI or an X-ray and someone can have a bone-on-bone arthritis, but if they have no pain, are you going to do a knee replacement on these people?
Right.
Then you're going to spend 6 months to a year recovering when you didn't have pain to begin with. So
Exactly.
yeah, or if they had pain and then you get rid of that pain, but they still have a bone-on-bone knee, why are you going to do surgery? So.